take a picture.
Well, good afternoon. Got busy eating my cake and my pie after dinner that I nearly forgot. But anyway, I was working on a few other things. Well, welcome. We're glad you're here. We're going to talk about the third installment of Supervision ethical considerations. Today we'll get started on that in just a second. I need to tell you this is Dr. Brandon. This is CD Seminars brought to you by Workforce Development Grant through the Department of the Oklahoma Department of Mental Health and Substance Abuse Services and the Department of Psychiatry and Behavioral Sciences. And so we're happy to be here with you today. Hope you had a good Easter, and we had a week off there, so hopefully that was a good time for you. Next week, we'll either have a surprise or Lenore will have something for us. So we're looking forward to one of those. Oh, yes. So let me go ahead and tell you this. To get credit, you need a text, and the numbers are, I'll write these down. If you're ready to copy, 12470, 12470, and then you need to text that to 405 562 5828, 405 562 5828. So anyway, so there you can get credit for it. So all right. So next week, and then we'll wrap it up in May, and then we'll have the summer off, and then we'll start again in September. So without any further ado, I think I'll go ahead and try to share my screen. Can everybody see my screen now?
Yeah, I can see it.
All right, good. Thanks for the feedback. All right. So we're going to talk a little bit about supervision ethical considerations. This is part 3. So we talked first time about concerns, ethical concerns related to supervision, informed consent. We talked about negligence. We talked about those kind of things, proximity, duty to warn, and all that stuff. So, and then in the next section, we talked about models of different models of supervision. So we'll try to pull it all together for you. We're going to look at some LADC supervision forms and identify some skills and knowledge for assessing supervisees, and look at some different types of feedback. And there should be plenty of opportunity for a discussion. So let's see here. So here's the basic idea of the form. I don't think this has changed much. It may have changed a little bit. So this is kind of the contract that needs to be in place before you get started. You're going to log your hours and then a couple of things. But here's what we really want to, let me go ahead. So here then begins actually the evaluation. So we're going to back up a little bit now. And remember what we talked about last time when we were talking about models. So when we're talking about models, we talked about there were 4 different roles. There's the coach role, the teacher role, the administrator, and the mentor. All of that is mediated by the relationship. And then we talked about an emphasis. So clinical emphasis is one that is focused on actual clinical skills and clinical activities. And so it'd be competence in being able to do a mental status exam. It'd be confidence in being able to assess risk. It'd be competence in those kinds of things. And then we talked about professional competence as an LADC, maybe to understand or know about substance abuse laws, or to know about the history of substance abuse and legislation in the United States, to know about the different kinds of substances that people use. Maybe it would be something like that. And then we talked about specificity, and this would be things that are kind of idiosyncratic or particular. So, if you were talking about gambling, that would fall down on this end of the continuum. That's where if you're talking about general substance abuse treatment, that would fall down here. If you were talking about recovery model just in general, then that would be down here. And if you were talking about something very, very specific, maybe like if your focus was primarily on, HIV and substance abuse. Or another example would be maybe endocarditis and intravenous drug use and endocarditis. Something very specific. Like Dr. Pinkin, you're talking about alcohol, liver disease, those kind of things. Very kind of specific things. So this is what we talked about. And then when we talked about the 4 roles, we talked about coach. So coach is somebody who, you just think about this as an athletic coach. So coach is somebody who helps somebody develop skills, whether those are general skills or skills. So you help them develop skills, you help them practice skills, you drill them in skills, you watch the skills. I mean, so, if you're a coach on a football team, you watch those recordings, the film on the team, and you grade how your offensive line, did it. And then you go out and practice and you talk about what are the drills, the kind of things they need to do to be a better offensive line. Same thing with other sports. Then you think about the teacher as being a teacher. This is a person who's going to teach and they're going to instruct. And we'll talk a little bit about some skills or competence in that, but teachers are going to convey knowledge and information. Teachers want to make sure that it sticks. They want to make sure that it can be applied. But a coach does a lot of actual application. Exactly. So how do we do that? Let me show you how we do that. Let me work on your skill. Let me work on your technique. Teachers teach theories and concepts and those kind of deals. Mentors are kind of like the professional role model. So this is a person who shows you how to be a psychologist, shows you how to be a social worker, shows you how to be a physician, shows you how to be a lawyer. And they're kind of your role models that you look up to. And so they tell you how to carry yourself and how you interact with other people. What is professionalism is another term that comes to mind. There's people you look at to say, okay, it's a behavioral health professional, This is somebody I look up. They kind of exemplify professionalism of a particular profession. And then administrator is the person who, knows how to push the paperwork, knows what the boundaries are, know what the ethical principles are, knows those kind of things. So think about these, keep these in mind. You might jot them down or something. And so then we're going to look at these competencies. These are the competencies required for certification to be evaluated. So these are the kind of things as a substance abuse counselor, these are the kind of competencies you need to have. So competency is, skill and motivate clients to actively participate, and a skill to do an intake. And then in terms of individual counseling skills, build rapport with the patient, identify, working through defense mechanisms, showing respect, stuff for the client, so forth and so on. So I should have had y'all vote on this, but I gave you the answer, at least my opinion of the answer. So I think that that's probably more of a teaching and a coaching kind of role. So teach. So you want to teach concepts, you want to teach theory, you want to teach those kind of things. Coach in terms of how you take that theory, you take that knowledge and you put it into practice. So I would say for these competencies in individual counseling, that they involve both the teaching role and the coaching. And then you've got these other individual counseling skills. Then you got group counseling. And so here you're talking about facilitating the adoption of an open-ended stance, your willingness to communicate, talking about exercise appropriate leadership in group activities, facilitate group memberships and sharing experiences, so forth, so on. So here again, I'd have to say that this is both a teaching role and a coaching role. Teaching role, and you might want to talk to the trainees about Yalom and about Yalem's book and about interpersonal group dynamics, and you might want to talk about communication skills, and Johara's window, and all those kind of things, the Storm and Form and Norman, all of those kind of things that we know about, kind of informational knowledge base for group counseling. And then the coaching is through demonstrating, through role playing, through watching video, through sitting in, and actually commenting on the execution of those skills in a group setting, or role playing, or modifying, or giving feedback on it. So I'd say, again, that's the group counselor, be the teaching and the coaching roles. Then they got working with families. And so here, assisting the families and significant others to recognize their own roles, advising families, giving others in developing productive behaviors, these kind of establish contact with families. Here again, I would have to say that, as a supervisor, you're in the teaching and the coaching roles. So, Dr. Pink is very knowledgeable about families and substance abuse and craft and how you implement it. So obviously that's a teaching role. And then getting in there and working with the family and having maybe her demonstrate some of those concepts and interaction with the family, and then watching you do it, and then making comments or giving you feedback on it, would involve both the teaching and the coaching roles. So screening clients, then we got formulating clients' treatment plan. So here I put, so this is like reviewing and interpreting existing records. It's informing the clients of their, their human legal rights and so forth. So I said again, this was a teaching and a coaching. I think it could also be maybe teaching, coaching, and administration, because I think there is something about how you write your treatment plans, how you formulate those, and so forth. So maybe we should have said that was a teaching, coaching, and administrative program. But when we get down to referrals down here, suggesting referrals for appropriate for the client, explaining to the client that the reason for the referral, recognize the serious medical, psychological, spiritual situations which are beyond expertise. So I put the administration and coaching. And administration, the reason I put that is because there's a lot of administrative knowledge you need to have. What are the boundaries? What are the ethics? What are the resources out there? Administrators of who do you call? then coaching in terms of how you enact that. So it could be teaching again, but I put administrative and coaching on that one. And then post-treatment planning and aftercare. So assessing the client's current status, preparation for aftercare plan, preparation for termination. I put teaching and administration. It could be coaching here, but teaching in terms, there's a lot of knowledge in this area about post-treatment planning and aftercare. Where are you going to go? You're going to sober living house, what kind of insurance you have or don't have, and what kind of treatment can that get you, and those kind of things. So there's a lot of administrative knowledge and a lot of teaching there. So I put teaching and administration for post-treatment planning and aftercare. And then the next one here, competency, is staff conferences and interactions. So, maintaining effective communication with others, staff members, functioning as part of the team, and planning cooperate. So here I put, the mentor role and the administrative role. In terms of administrative role, how do you structure meetings? How do you run meetings? How do you take minutes if you need to meetings? Those kind of things. And mentoring in terms of just kind of bringing people along and being a role model for how you do this staffing conference interactions competency. Oh, let's see. Record keeping, I put that was pretty much administrative, although I suppose that there could be some teaching there. So this is maintain all records, summarize, transmit records. So it sounds like a lot of administrative role there in terms of the supervision. Then we talked about responding to program inquiries over the telephones, as like people call in or they seek treatment. So imparting clear communication over the telephone, conducting initial evaluation. So I'll put back to the coaching and the teaching, or the teaching and the coaching here. There's a lot of knowledge to be, distributed or given to the trainee, but then a lot of showing them and feedback to them. Same thing here for the crisis intervention. Well, there might be some administrative stuff to that in terms of knowing where to go and who to get in touch with and what to do first, second, and third. Whoops. So I'll put the coaching and the teaching role here. Didactic presentation. Now, this is kind of interesting because a lot of social worker, I don't know if psychologists, they really have that as a competency that you should be able to do didactic presentations to clients in the community. But that patient education piece is so important in substance abuse treatment that is listed here. So this would be like familiarity with accurate, up-to-date information. That's why you go to CD seminar and those kind of things. Alcohol and drug abuse. So here I put. To me, it's teaching and mentoring here. There's knowledge in terms of how to do, structural, educational design and how you do presentations and, whether you use PowerPoint or you don't, and all those kind of technical kind of things that you would learn, people would teach you. And then the mentoring, the reason I put that is you got to kind of watch and see somebody do it. Although coaching could certainly fit here too. In terms of coaching, it might be actually watching somebody give a presentation and they giving feedback or making recommendations about what they could do better, improve their form or their delivery or those kind of things. So it could be teaching, it could be coaching and mentoring. Counseling is kind of interesting. I just call it counseling as a competency, but this is having a philosophies, policies, procedures, practice, or knowledge of the philosophies, policies, practices of Alcoholics Anonymous, AA, NA, and other self-help groups, community-based self-help groups. So here again, I put administrative in terms there's a lot of knowledge base to that, and one or more counseling theories, and then mentoring in terms of how do you interact with those groups and how do you connect people with those groups. But it could be coaching again. And then the last competency is, knowledge about federal, state, and local regulations and license laws and those kind of things. And I put that was primarily administrative laws of confidentiality, Section 2 of Federal Register 42 in terms of substance abuse treatment. So all of those would be, I put those administrative, although you could say teaching too, because you could certainly have didactic presentations on all that stuff and teach it to them. But so the point here was just kind of go over this with you to kind of explain to you these roles and how these roles would be applied to these different competencies, because it's for some competencies, it's more of an educational endeavor. For some competencies, it's more of a coaching or a mentoring or administrative role that you're taking with the trainee. And then, so we may come back to some of that here in a minute. And then you got your last form is where you sign off, and then you have some comments. So I'll stop there for just a second and see if there's any comments or anything anybody wants to add. All right, if there's nothing to add, we will move on. So when we're talking about trainees or education, we're talking really about three kinds of assessment or feedback. These are big categories. So one is diagnostic, and that's assessed before you actually begin. I have in the past, like, given trainees, like a question and answer kind of thing, like a test, like no different theories, no different ideas, those kind of things, just to assess. And then we would go over those together and talk through, knowledge, actual knowledge questions about cognitive behavioral therapy or about addiction or about detox or those kind of things. And then we'd go back and talk. So my idea there was to assess diagnostically, what's the trainee know or not know as we get started. I don't do that much anymore. I usually will sit and talk with the trainee, you know about this or tell me about that, kind of trying to assess, kind of where they are. And then there's formative evaluation or formative assessment. And this is learning on the go. This is as you go. So this is typically what we would think about, in supervision. So, trainee comes in and how's it going? And you look at some film or you listen to a recording or something like that. Then you see what they're doing and you give some assessment of how they're doing and you make some feedback about things they could do better. Next visit they come in, you talk about those because it's formative. So it's ongoing, and it's really the idea is assessment for learning. And so it's this idea that, you're getting feedback, you're learning new stuff, you're incorporating new stuff. And so you're learning as you go. And then you've got summative. So just like the word says, so this kind of sums it all up. And so this is ending. So, and usually this is what we think about, at the end of supervision, we're going to give some kind of summative evaluation that says, yeah, this person is competent in our minds. They've demonstrated, skill and safety in these various competency areas, just like we've gone over. So I know they can interview a family. I know they can do an assessment. I know they know something about detox and withdrawals. I know they know something about that. And that something would be considered, sufficient entry-level knowledge. So you wouldn't expect them to know everything about everything, but I would expect you to know what the classes of drugs are and what their interactions are, not necessarily the interactions, but what their what their intoxicating effects are and what the withdrawals look like and what you might do to do those. I would expect that you would know how to do a pretty decent risk assessment of a patient. So all of those kind of things. So this is at the end. And then, the big summative thing is when you take an exam at the very end and you have to pass the exam to get your license. Well, 100 years ago, back a long time ago, before there were LADCs, there were KDACs. And so to become a certified alcohol and drug abuse counselor, you had to do a lot of stuff. You had to take a written exam. It was a very challenging written exam. And then you had to pass it. And then you had to do an oral defense of a case that you wrote up. So to become, certified as alcohol and drug abuse counselor is a KDAC. So that would have been a summative experience. And, those can be fairly stressful. So diagnostic, formative, and summative are all types of assessment and feedback. And then when we're talking about 4 levels of education or evaluation.
So, Dr. Rand, you don't have to do that anymore?
I don't know if you do. Now you're an LADC, and so I just kind of floated over. So I don't know as an LADC if you have to do a case presentation, and I don't know what the exam is because I did all that.
I had to do a case presentation and take the written test.
Well, it was fun, wasn't it, Lenore?
No, it was quite stressful, like you said.
so that's Good example of summative evaluation.
Right?
Very good. Yes, thanks. So, thanks, Lenore. So this is what we're going to talk about, 4 levels of evaluation. So we're talking about attitude and emotion. This is kind of subtle. I don't think we saw much in the competencies about, attitude and emotions, but this has to do with inclusiveness. It has to do with multiculturalism. It has to do with those kinds of things. And some licensures and some organizations will have specific competencies about that, cultural competencies. Then knowledge, and this is just kind of, knowing the facts. And then skill is, is like is a skill to be able to shoot a basketball, or it's a skill to be able to putt a golf ball and hit the hole or drive it down the river. So it's skill. So this is like your delivery. This is like your timing. This is like how you say things. This is like, rapport is a skill. So there's things that you say. So motivational interviewing, being able to do motivational interviewing is a skill. And then effectiveness is kind of a newer kind of evaluation level, but that is it working? Do people get better? Do they improve? So attitude and emotions, knowledge, skill, and effectiveness. So these are the 4 levels or 4 types of evaluation. So we can't talk about evaluation feedback without talking about good old Bloom's taxonomy of educational objectives. So this is used over and over and over. It's a great kind of heuristic model to think about evaluation, think about learning objectives and those kind of things. So we'll talk here about the new model. We'll go over these in a little bit more detail here in a second. But, you got to remember, you got to understand it. Then you need to be able to apply it and be able to analyze situations using your knowledge, evaluate outcomes. That has to do with effectiveness. And then creating. And creating has to do with doing new things with the old concepts. So here we go. So we'll start off at this is a pyramid upside down. So remembering. So can the student remember the information? And so when you're doing supervision, it's kind of like you remember a guy named Carl Rogers. You remember what he had to say about rapport and unconditional regard and all those kind of things. And so you remember Bandura, and he talked about self-efficacy, he talked about motivational efficacy, he talked about emotional efficacy, he talked about problem solving, those kind of things. So sometimes you need to jog the trainee to say, remember this, you had this. I'm sure you had this. Yes, you had. Okay, so you get the concept, pull them up, So then there's the idea, can you understand the concept? And so I can tell you that I know, about rapport or unconditional, empathy or personal regard, but can I tell you what that is? I mean, do you understand it? I can remember it, but do you understand it? And then the next thing is, can you apply it? And so if I'm talking to a patient, can I apply that? Can I actually, demonstrate that? Then we're talking about skill, and then analyzing it. So, if you're talking about motivational interviewing, for instance, do you know the different pieces of motivational interviewing? If you're talking about, things like uncovering deletions, does training know what that is? If you're talking about exploiting ambivalence, do you know what does the trainee know what that is? Can they distinguish that from uncovering deletions? And then if you're talking about motivating people to take action, can they identify the DARN, DARN, that underlies motivation? And then if you're talking about taking action or making a plan, can they do it? So can they analyze and distinguish between different parts? And evaluating is, can they make some kind of evaluative, statement about this was good, or can they appraise it, or can they defend their position, those kind of things. And then you've got creating. That's where you're going to take something and you're going to apply it in a new situation. So, when we think about Bloom's taxonomy and we're thinking about learning objectives, we think about, using, these descriptors here in terms of these descriptors kind of represent these concepts of remembering. So you can remember, you can duplicate it, you can list it, you can memorize it, you can recall it. understanding means that you can classify it, or you can explain it or discuss it, or you can paraphrase it, those kind of things. You can pick it out of a list. Applying means that you can choose the correct one, or you can illustrate it. And by that we mean, you can describe it. You could write a story about it, or you could write a paragraph about it. Those kind of things, depending on whether you're talking about skill or you're talking about knowledge. And then analyzing, can you evaluate it? Can you critique it? Can you differentiate and discriminate between different pieces of it, or between one theoretical approach and another theoretical approach? Can you differentiate it between one technique and another technique? And even better, why would you use one technique in one situation, maybe another therapeutic technique in another situation? And then evaluating is, like we said, can you defend your position or your reason? Can you judge? Can you evaluate why you would use something in one case? And creating would be a similar constructor design. Usually we think about applying some concept like, Piaget, his idea about cognitive development has been applied, over and over and over to different situations. And so, so when you're thinking about working with, and these are higher level, the further you go up the pyramid, the more sophisticated higher levels of learning. So if you're thinking about somebody just coming out, you maybe spend a lot of time with helping them remember, helping them describe or talk through the theories, understand, and then you may begin to work with them on how would you apply that with this situation, or how would you apply that with this kind of patient, those kind of things. So this is Gaines' taxonomy of learning. And so these are the outcomes, the definition, and kind of an example. And really it's these intellectual cognitive tasks and skills that we're looking at. But it's similar to what Bloom would talk about, but discriminate. Can you pick them out? Can you distinguish objects? And there'd be an example, by tech feel, can you feel the difference between different fabrics? Kind of a ability to use your tactile senses to feel differences in fabric. Concrete concepts. So this is identifying class, subclasses, those kind of things. And so picking a wrench out of a toolbox. So if I said I need a 8mm crescent wrench, could somebody, or square inch or box or closing, could somebody go find that? And define concepts would be to classify things by ideas. So, is that a Rogerian technique? Is that a cognitive technique? Is that a cognitive theory? Is that a psychoanalytic concept? Those kind of things. Rules, applying a single relationship to solve problems or class problems. So here, so this would be like picking on applying a single relationship to solve a class of problems. This might be something like the idea that if you're getting stuck in a counseling session or something, you go back to empathy. If a person becomes, defensive, then you, rather than press the defenses, you fall back to developing more empathy, and then you try again, something along that line. And then higher order rules. And so, so rules are complex. And so ethical rules at their top, and relational rules, and therapy relationship rules are next. And next are, different kinds of relationships. And so we're able to say, well, this is probably what you'd want to do, but this rule trumps that one. So confidentiality trumps this or that, or safety trumps confidentiality. So this is just kind of Gaines' idea. This is one Simpsons that we don't talk much about, and of course I've just like a dead horse. State of the art good supervision is recorded supervision or live supervision. So it could be verbal. It could be auditory. It could be it could be film. It could be any kind of recording. But good supervision requires recording. And here's one of the reasons, because otherwise you just talk, or it could be live supervision, but otherwise you're just talking about what you think happened. So when you're actually watching it, there's this level of perception. So you got to become aware of the need to act. And then after that, it's kind of like the set, that's preparing to act. And then there's a guided response, which is responding with assistance from a teacher or a coach. And then there's, a mechanism, which is, habitually being able to respond to that. With complex responses involve uncertainty and performing difficult tasks automatically, adaptation and altering responses to fit the situation, and origination is creating new acts. So you think about this, you think about a football team or something like that, and offense shifts into a different formation, and then the defense recognizes it. So they're stimulated to see a need for action. So then they shift. And in shifting, then they prepare for action. So the defense then responds to the way the offense has kind of set itself up. They shift. They recognize that means something's different. So they it's a stimulation for response. So then they respond, they shift, and they prepare for action. And then the coach gets out there and he talks about now that, when a player, an offensive player, runs over here, does this, or when the line does that, or when they do that, that means you're going to do it. So you may have been a coach, or as a kiddo, you got coached. The coach grab you and kind of pull you over and say, I want you over here. You need to be further over. And I want you to face this way, and so forth and so on. And so that's that guided response. So when you're thinking about this in counseling or psychotherapy, so becoming, being aware of stimulation and the need for action. So, when we've been doing this a long time, when we see a patient that, looks a little startled, or they look down, or they look away, or they have a, kind of a slow response, we recognize, oh, we've hit some emotion there. Maybe we're talking about something that's particularly sensitive, the patient's sensitive to. And so then we're aware that we need to prepare for action. So we need to probe that, or we need to support that, or we need to do whatever we need to do. So we kind of learn that, but we learn that this guided response helps us do that. And you don't see it unless it's recorded. So I go, what did the patient do? They responded, and you kind of just push right on through that stop sign, that red line. I think the patient had something else to say there. It looked to me like they were tearing up, and you just kind of ask another question without asking, so you seem to be bothered, or what are the tears about? And then as you learn how to do that, you're able to respond habitually, and then you're able to do those same kind of complex things in different situations. Like you might be doing it in an ER, you might be doing it some other place. And so, but I think this part about Simpsons, about perception, set, and then guided response, we don't think about counseling psychotherapy being, I think about football, basketball, those kind of things. We don't think about counseling really being something that we have to be aware of what's going on and then have responses to it. Okay, then Gange's 9 events of instruction. This is really, I think, for more didactic things where you need to gain people's attention. You want to tell them what the objective of what we're going to do today is about. Then you're going to want to recall memory. So you remember there's a guy named Piaget, and he had a theory of, a theory for cognitive learning, and he worked with kids. He worked with his own kids, and so everybody pulls up those memory banks. And then you present the content. So you're going to lay out the distinctive features, and you're going to provide then you need to provide guides. So this is a way to organize the information. So we think of frames, FRAMES, and frames means this. So that's a way of organizing motivational interviewing. And then eliciting performance is ask them to perform. So how would you apply frames to this case that we just talked about? Or what would you say? So that might be even role playing. So tell me how you would do that. So how would you give me feedback? How would you promote responsibility? How would you advise change? Those kind of things. And then you provide feedback. So when you said that, it seemed this way to me, or I felt a little pushback on that, or I felt kind of demeaned on that, or those kind of things. So you're giving feedback. Or if you're looking at a recording, you're providing feedback in terms of what you're seeing as a experienced counselor. You're providing them feedback on what you see happening in the interaction between them and the patient, the trainee and the patient. So assessing performance, and then enhancing retention and transfer. So this is in terms of instructional event, you think of supervision, you think of training as an instructional event, even though I think this was probably developed for like didactic or lecture kind of things. It makes good sense. So here's one from the medical literature, and this is teaching reasoning through the 5 micro skills. So this is called the 1-minute preceptor. So if you just have, this is for bedside teaching. So if you're making rounds with trainees and you've only got a little bit of time, how are you going to, maybe you got 5 minutes or something, really kind of talk about a case at bedside or out in the hall or something. This is kind of what they would recommend. So the first thing you're going to do is you're asked for commitment. So you want to get this training, say, well, so you want to know about this problem, you want to understand this better. This is kind of a baffling case, or this is a case kind of problem you're going to run into a lot. So you're trying to get some commitment. So this is basically, you're going to get attention. You're going to inform them of the objectives. So same kind of thing here. So you're going to ask for commitment. And then you're going to probe for their reasoning. So why do you see it that way? Or, and generally speaking, in this medical setting, we're talking about a diagnosis. So did you arrive at the diagnosis? So the paper that is written on is, the differential between gout and osteo something or other. So the novice student would say, okay, well, it's gout, but the resident would be able to say, no, this is osteoarthritis. And so they would be able to differentiate the two. So if that was the case, then you're going to probe for the reasons. So the medical student might just give you some, well, it's red and it's swollen and it's stiff and it hurts. So that's what we learned. And so that means it's gout. That's where, if you're talking with the resident, they may say those 3 things, but they may talk about age, or they may talk about other kinds of kind of higher level learning that would differentiate, say, gout from osteoarthritis. And then you get into the teach. And so I should back up here. So initially you ask the patient for their formulation and their diagnosis. And so they give that. And then you're going to, then the coach or the supervisor then is going to help the trainee by getting commitment and then probing for their underlying reason. And then you're going to get into these 3 points of teach. So then the idea is to give some general rules. So when you're talking about, gout, we're always looking at this and this and this. Osteoporosis, osteoarthritis, we're looking at something else. Then you're going to find some positive feedback to give. I think you did a good job in getting the patient to tell you, you get a job in reading the labs, you get a job in whatever it was. And then you correct any errors. But some of the things you should consider when you're talking about gout versus some other inflammation of a joint is this or that. So when you're thinking about, psychiatric things, you think about mental health things. So as the trainee. And I should tell you that, so the whole 5 minutes is split up this way. So one's a case presentation by the trainee. And then about a fourth of it's going to be the inquiry, and a fourth of it's going to be the discussion. So for about half of that time, you're just giving it to the trainee to have them explain it. So in psychiatric behavioral health, substance abuse stuff, you might say, so tell me about what you think the patient's diagnosis is. And so, about half the time, whether that's 5 minutes or 3 minutes or 10 minutes, about half that time is given to the trainee to kind of explain the case. So I think the person has, it's a alcohol dependent based on this, this, and this, and this, and this. And so then you might say, so you want to learn about alcohol and how it affects the body, or withdrawal symptoms or intoxicating symptoms or whatever else. So yes, so then tell me about how you understood that. What criteria were you thinking about when you were talking about alcohol dependence? You're thinking about major depression disorder or something like that. And so you're going to probe for that. And then, so that's the inquiry piece. So that's the kind of diagnose the learner. That's probing for what they know. And then the discussion is going to be, so when you're thinking about depression or you're thinking about alcohol use disorder, we think about these kind of things, think about tolerance, we think about withdrawal, we think about intoxication, think about loss of ability to control, we think about those kind of things. And so you might go over those kind of things. And then you're going to say, yes, I think in terms of, excessive use, you were right on there. But, in addition to excessive use, you need to think about, their physical health or the effects it has on their, their thinking or those kind of things. Thinking about, ASAM criteria. You might be thinking about, okay, so, you got to think when you're thinking about medical conditions, you're also thinking about, comorbid kind of things like cardiac problems. You're thinking about hypertension when we're talking about whether we need to send somebody to inpatient treatment or not. So I think that gives you kind of the idea. So it was Gordon that came and she wrote a nice little article about that. And, I think it's New England Journal of Medicine. So, all right. And so another taxonomy, this is Barrow's. And basically, this is kind of a list of different approaches. And a lot of this is kind of based on the idea of giving lectures, but I think it still applies to supervision. So you can do a lecture-based case. And so basically, you're going to lecture around the case. And so you give a few details about a case, and then you kind of lecture, you talk around it. And then a case-based lecture is where you give the trainees the case to study beforehand. So, if you're doing supervision or group supervision, you might hand out a redacted case, no identifying information. So go home, think about this, and tell me what you think the diagnosis would be. Tell me what your treatment plan would be. Tell me what the ethical problems with this case are. And they come back, and then you lecture or you talk about, what the answers are, what you hope they got out of it. A case method is where trainees are given the case to study before the discussion of the case, and the supervisor does some guided exploration and evaluation. So they get it before the discussion, they look at it, and the supervisor actually gets it. And it's hard to say what the difference between a case-based lecture and a case method are, except case-based has more of a lecture, and case method has more of an exploration or guided evaluation by the trainer. A modified case approach is small groups of trainers give a case to work up. And we used to do that in a clerkship. We'd give them a case on substance abuse, and they divided up into groups, and they went into separate areas, and they had to analyze the case. They had to come up with the diagnosis of what they thought they needed to do, and so forth and so on. And then there's problem-based, and trainees are given a case or a problem to address. And here again, the supervisor guides the evaluation. And so, and that's commonly used in supervision. I don't use it much anymore, but I have a whole bunch of old cases, redacted cases, interesting cases. And sometimes we'll get those out or we'll review those or we'll talk through those. And then a reiterative problem-based is where you're going to give them an episode. So maybe you give the trainee or a group of trainees, if you're doing group supervision, you give them, part one, and it says, the patient came in, it's kind of the presenting problem. And then you talk about it, what would be important to get out of that. And then you give them, this next piece, and then they study that and they talk about that and say, okay, so how does the picture change now? What are you going to do now? And you talk about that. So these are just some ideas, whether you're doing group supervision or you're doing training, more in an academic setting or consultation, things that you can do to try to make the training meaning. Now then, we're not going to go through these exercises. Maybe we'll have about 10 minutes here to talk maybe if y'all want to, or go back and revisit some things. But when you're talking about supervision and giving feedback and doing all those kind of things, for the trainee, there's two kind of things that you need to think about: knowledge and skill. We just talked about, so you got attitude, you got emotion, and you got knowledge, you got skill, and you got effectiveness. So particularly in supervision, we need to know what the knowledge base is. And so if you're talking about individual supervision, or you're talking about that competency of individual counseling, it would be good to think about what's the knowledge base that you would expect somebody to have. So I mean, should they have read what's his book? Trans Theoretical Model, that book. I can't see it on my shelf right offhand. I mean, should they know that? I mean, is that a knowledge base? Prochaska and De Clementi, I mean, should they have read that book on the different approaches, the counseling, and then kind of the trans theoretical model? Should, with crisis intervention or with assessment and referral, is the knowledge base that somebody should know the ASAM evaluation placement criteria, and it should have read the book. So all of those would be knowledge. So those are knowing kind of things. And then skill is can you do it? So, if you're talking about individual counseling and you're saying, okay, so you should have read that, Prochaska de Clementi book on Terence de Reta model, where they go over kind of different. So the skill is, can I develop a contingency, a contingency plan, a behavioral contingency planner? Can I do graded imagery with somebody, or can I execute frames with somebody? Do I know what frames are? And then can I talk somebody through motivational interview frames? Do I know what darn means? So do I have the skill, the ability to talk about desire, talk about need, talk about ability, and talk about resources and how to promote motivation? So those are the two things, we're always talking about, is what's a knowledge base and then what's the skills being the execution. And then, thinking about a method of feedback for knowledge and for skills. So, that's where the coaching comes in. That's where the teacher comes in. That's where the mentor comes in. That's where the administrator comes in. So when you're talking about record keeping, there's knowledge about what you need to do. There's laws that you need to know about. There's basic, kind of things that people need to know. And then there's, the ability to execute that. And that's probably more in the administrative knowledge and administrative skill. It's where, staffing conferences. There's some stuff out there about how to run good groups and how to do staff meetings and how to develop treatment teams. And then there's skill in that. But it's much more subtle. So it's probably more mentored probably than it is others coaching aspect of that too. So we're not going to, if we meet in person, I'd give you a little vignette. We'd ask you to figure out, okay, so what's the skill, what's the knowledge base you need for a particular competency? What skills should you be able to execute, and how are you going to get feedback? So you get feedback through coaching, you get feedback through role play, you get feedback through any of those things. So it's kind of what we would do here. So that's kind of it. I forgot what this is. Let's see what this is.
These bins have to be the most disgusting thing in the modern kitchen, and yet we all put up with it. So our government wants us.
Can you? Anybody?
We can hear it. I can't see the video.
Hey. Nice to see you around here.
Still can't see the video.
Yeah.
Try that. Can you see it now?
So looking forward to it.
Yeah.
So how
All right, watch a little of this.
Yeah, I've been living life now, just doing what I do best.
What do you think about this
So,
counselor
any
skill?
particular reason why you're here? I've called you into several meetings, haven't seen you. I don't know. You tell me. It wouldn't happen to be about the eviction notice? Nothing that it doesn't concern you? It does concern me. I want to help you out. And the council told me that you're being evicted in 3 days. Yeah, I am. I'm gonna get kicked out of my house, okay? My apartment they're just gonna kick me out like I'm no one in society. Yeah, they're doing that. It would be possible to stay in your apartment if you paid your rent. Yeah, well, it's not my fault. Bills and everything else is piling up in the corridor. I don't know what to do. If you open them up and pay them, it would help. Yes, I know, but there's so many. There's just too many to do at the same time. Really, it's just way too many. I've really tried to help you on this several times, yeah. All right. I heard that many times before. What's happened? I mean, you were doing so great. We got out of rehab. You had everything under control. You were showing up to the meetings. I knew what was happening. Yeah, well, I don't know. I've tried to do my best. I'm like living life the way I know how to live it, and that's it. I mean, like, yeah, I'm sorry that I spending it on drugs and everything, but you're spending it on drugs. I mean, I'm not spending on drugs. I'm just saying an example, yeah. Are you on drugs again? No, I just don't know. I'm so confused right now. Listen, with life. Oh, Tammy, I so really want to help you. I've really tried to help you. I was in your shoes once. Yeah. And I really want to help you. Sure, heard that. I don't want to see you on the streets. None of us want to see you on the streets prostituting yourself because you need dope. You were doing so well. Yeah.
All right, so we got a little peek of that. So let's see here. So we'll come back over here And so, so the lady who's sitting behind the desk is the counselor, in case you had trouble not understanding that. But let's talk about motivational interviewing. So if you're going to talk about, motivational interviewing, and we were going to talk about the knowledge base that this counselor needs to be able to execute motivational interviewing. I'm gonna stop sharing now, but what are your impressions in terms of the knowledge base that would help her, or does she have a knowledge base? Let's just put it that way. Dr. Fink, if you're still on listening, I would think that this would be right up your alley.
I think first of all, excuse me, she needs to have the unconditional positive regard, and I'm not hearing that necessarily.
Right. So we might have to have her go back and do a little remedial reading. What do you think, Dr. Fink?
I had a little trouble hearing it all, but the thing that I most noted was her body posture was closed off and not non-judgmental or welcoming or open or anything. That was the major thing that stood out to me.
Very good. And that symptoms kind of cues to action. What are you seeing and how you're responding? Are you able to do that? So, so the lady, the patient here, the client here, she's kind of laid back, and the other lady's leaning across the desk, got closed arms. I mean, she's not looking warm and receptive. Very good. So what else anybody thought? Cynthia, you got an idea? We've talked about this.
Yes. I thought she was jumping towards change. And I could be saying this wrong in my terminology, but like the change talk in the patient wasn't what she was assessing properly, I felt. She kind of like jumped into already making recommendations, allowing and that caused patient to kind of be resistant.
That's very good. Yes. So she got defensive pretty quick, and by getting defensive with the patient, the client there, she ended up in this kind of circular kind of in status quo talk rather than change talk. So very good. All right. Anybody else got a thought or comment, both in terms of skill and knowledge? Yes, ma'am.
So I think that she did a very, very poor job of listening to her client, even to try to connect, and she would interrupt. And so the client really never had an opportunity to express what was really going on with her before the therapist interjected her opinions on what was the solution.
So that's probably a coach. I mean, there's some probably some teaching to be done in that, but there's also a lot of coaching, either through watching a video. Hey, what are you doing here? Look at how you're doing. Dr. Finkel talking about body language, but yeah, so those are coaching kind of things. Those are skill-based kind of things where you're talking about coaching. So we're gonna role play this case, and I'm gonna be one, and you're gonna be the other role, and we're gonna talk about how we would act differently. So you get a coach. It's like your volleyball coach or your basketball coach, pull you over on the floor and say, you need to be here and you need to be facing this way. So same kind of thing here is a coaching idea. You're very correct on that. We got maybe one more comment, and then we got to go. But other thoughts? All right, Frida, you got anything to add? All right. She may be asleep. Okay, guys, we'll be back next week, and we'll have another presentation. Thanks for your attention and your participation, and we will hope you have a good weekend. So take care and be safe. Thanks a lot. Bye-bye.
Thank you.